After viewing this video, your blood pressure might never rise again. The most crucial fact regarding high blood pressure is the fact it is a signal. The issue with hypertension is that 90% of cases are categorized as critical high blood pressure. For this reason, we will discuss the core reasons in this clip. Ways of life or heredity may be at blame. If, however, you quit cigarette consumptions, avoid consuming alcohol, do some fitness, cut back on sodium chloride, and shed few pounds, perhaps it will disappear. There are likewise many persons without high blood pressure and isn't they doing workout or any fitness. Additionally, there is a sizable population that does not have hypertension despite consuming a lot of salt. Moreover, 25% out of 100 medications to treat hypertension don't work when used. How come that wouldn't work? Considering that they are addressing the indication, the origin isn't being treated by them. The issue is concealed whenever a symptom is treated without addressing the underlying cause. Then it goes on. It is not my intention to advise you to stop taking the drug without your doctor's approval if you have high blood pressure. But I have some crucial information for you that will assist you get to the core of the problem. Let's start with the main cause of this issue, which is vitamin D deficiency. Low vitamin D initiates an immune system identified fluid regulatory system, which causes your arteries to constrict, as the narrowing constriction of blood vessels by small muscles in their walls called the vasoconstriction. These basically means that your arteries are being pushed down, which raises blood pressure. As a result, your blood pressure will rise. The cause of such is inadequate vitamin D. Due to elevated blood pressure, this system will increase. Therefore, excessive sodium retention is also a result of high water follows sodium wherever it goes. More water, more pressure, and more sodium. For this reason, there is a strong effort to put people with high blood pressure on a low sodium diet or off of potassium altogether. Giving the individual in question a D supplement and raising their potassium intake would be far more beneficial. The higher your potassium levels, the higher your salt intake. The sodium-potassium shields your body from too much salt. Individuals that are sensitive to salt will consume a significant amount of salt. They will be severely deficient in potassium. Sadly, because you require so much potassium, most people don't receive enough of it. You require approximately 4,700 milligrams daily. Nobody is receiving the equivalent amount. Take a look at the number of people who lack adequate amounts of vitamin D. It's simply incredible. The fact that the danger of hypertension increases in the cooler you are more exposed to high blood pressure if you have darker skin. The reason such occur is as a result of the pigment melanin in your skin serves as a sunscreen. Generally speaking, having dark skin doubles your risk of high blood pressure, which makes vitamin D production more challenging. For this reason, the more vitamin D you need to take, the darker your skin. The issue of inherited elevated blood pressure then comes up. It's interesting to note that that's typically linked to a hereditary vitamin D issue. A remarkably high proportion of individuals who have a hereditary vitamin D deficiency cannot take in vitamin. I have even asked whether our blood pressure issue is truly inherited, or is our elevated blood pressure due to a genetic vitamin D deficiency? Since 90% of blood pressure issues are essential, that is, have no recognized cause, I mentioned that. Hence, it can be way of life. Inheritance may be the cause. They are in the dark. We simply have no idea why they would stuff all these lifestyle items into our children. However, continue taking the drug in the interim. as we need to maintain low blood pressure. While we identify the problem, this relationship to insulin resistance comes next. When you eat a lot of beverages or carbohydrates, this is a sign of elevated blood glucose levels, and it's the main reason for high blood pressure, high cholesterol, belly fat, excessive blood sugar, and a fatty liver. Simply said, it's insulin resistance. This is more likely to occur if you have low vitamin D levels, since obesity dilutes vitamin D and either causes insulin resistance or just raises blood pressure. It may be one way why some obese people acquire hypertension. Magnesium allows vitamin D to function. For vitamin D to function, magnesium must be present. Therefore, these are related. I included potassium, magnesium, and vitamin D for this reason. Those three are there. Let's examine another relationship between calcium and vitamin D in soft tissue. You have this condition where your arteries can get stiff due to an excess of calcium, which can actually cause your blood pressure to rise. You are taking vitamin K2 to guide the calcium into the teeth or bone and out of the soft tissues. One test that is a very effective indication or predictor of mortality from every cause is the coronary artery calcification test. That's why those who experience cramping an excellent measure of death from all causes. People who experience pains at midnight or just in their ankles or heels need more magnesium ions because of this. Magnesium keeps calcium from accumulating in the tissues. Consider postmenopausal having to do with the time after menopause, who use calcium tablets as well. They will not be able to take tablets of calcium. They are at a greater danger of having a heart attack because of all the calcium you're dumping. I mean, some women take anywhere from 1,200 to 1,500 milligrams of calcium daily. They occasionally even take it alongside vitamin D. They still run the danger of developing heart issues. For what reason? Because they don't have enough magnesium. Magnesium prevents clot formation. By preventing excessive calcium levels, heart attacks, arrhythmias, thrombosis, and coagulation can all result from an excess of calcium. Magnesium is the remedy to heart attacks and arterial accumulation. Calcium channel blockers and beta blockers, which block adrenaline, are examples of drugs used to treat high blood pressure. Vitamin D is one of the natural beta blockers that can naturally lower adrenaline. Supplement with vitamin D to treat high blood pressure. Sunflower seeds and pumpkin seeds. Magnesium supports the activity of vitamin D. A low-carb diet is advised because too much sugar and starch depletes potassium, magnesium, and vitamin D, which can lead to heart disease and metabolic syndrome. Potassium recipes that could help lower your blood pressure.